Welcome back. Egypt have received on Sunday the first batch of AstraZeneca vaccine to face the COVID-19. To shed more light on this, we have the pleasure to have this phone with Dr. Walid Al-Khatib, Professor of Microbiology and Immunology. Good afternoon, Dr. Khatib.
Good afternoon.
Doctor, could you give us an idea about the vaccine that Egypt have received today?
Okay. Actually, I'm interested to tell you about the differences between the Chinese, English, and Russian vaccination. Basically, they differ in the methods of preparation, and accordingly, there are several types of potential vaccines for COVID-19. For example, inactivated or weakened virus vaccines, which use a form of virus that has been inactivated or weakened, so it doesn't cause disease, but it still can generate an immune response, such as Sinopharm vaccine that we received last week. The second approach is the viral vector vaccine, which use a virus that has been genetically engineered so that it cannot cause disease but can produce coronavirus proteins to safely generate an immune response. This is such as Oxford AstraZeneca vaccine that we received today, as well as Sputnik, the Russian vaccine.
Yes.
The third approach is through RNA and DNA vaccines. And it is a cutting-edge approach that uses genetically engineered RNA or DNA to generate proteins that itself safely prompt an immune response, such as Pfizer, BioNTech, and Moderna vaccines.
Yes. Dr. Khatib, I would like to ask you, you've just mentioned the Chinese and the English and the Russian vaccine. So concerning the citizen, how is the citizen going to decide which vaccine to take, either in Egypt or abroad? I mean, does it goes back to the doctor? He's going to decide what is suitable for the patient or the citizen. After some, for example, some analysts and some X-rays, for example?
Okay. The vaccine actually should be delivered to individuals with who did not expose to COVID-19 infection. So this is a healthy individual, not a patient. So, and this is the main difference between vaccine and medication. So vaccine should be delivered to healthy individuals to protect him or her from getting infected. But medication is delivered, or drug is delivered for patients who suffered already from infection. But if you ask about what determines the choice of vaccination for available vaccine, the vaccine should essentially pass phase 3 of clinical trials, also affordable logistics and conditions of storage and temperature. For example, it's preferred to be stored at 2 to 8 degrees centigrade, which is the fridge temperature, instead of 20 degrees or minus 20 or minus 70 degrees centigrade. Also, the choice of vaccination depends on approval criteria of clinical trials of the vaccine. For example, if it has been tested on non-pregnant female volunteers, it cannot be used for vaccination of pregnant ones without appropriate assessment of such category.
Yes. So, doctor, with the start of giving the vaccine to the medical staff, what is the next step?
Okay, that's a good question. Based on the CDC recommendations, the phase 1E includes residents and staff of long-term care facilities and healthcare personnel, with an initial focus on healthcare workers critical to the mission of the preventive death. And phase 1P includes all people aged 75 years and old and the frontier essential workers such as firefighter, law enforcement officers, food and agriculture workers, post office workers, manufacturing workers, grocery stores and public transit workers, while phase 1C includes all people aged from 65 to 74 years and older, and people aged 16 to 64 years with certain underlying health conditions that puts them at high risk of severe disease. Finally, phase 2, which includes all people who wish to be vaccinated, and that will be the last phase of vaccination based on CDC, our Centers for Disease and Centers for Disease Control and Prevention in the United States. And generally, the most of the world countries follow such recommendations.
Yes, I thank you very much for your time and for your valuable information, Dr. Walid Al-Khatib, Professor of Microbiology and Immunology. Thank you very much for joining us over the phone. Ladies and gentlemen, a short break and I'm going to be back with you.